strategic assessment, I know for me personally, in my job, it's kind of helped me out with some of the things I've got going on right now. So I'm hoping that we meet your expectations for this. I feel like you've given us some good feedback. I feel like we've gone back and kind of done that, but we'll start it off. And at the very end, of course, if anybody or anything has any questions, feel free to ask, and we'll do our best to try to answer whatever questions that you may have. So I think, Brandy, you're kind of leading us off, so I'll turn it over to you, and I will take and do the slides.
Okay. Thank you, Jeff. If you want to go ahead and skip over to the first introduction slides, fine. I'm not going to go over the table of contents because it's pretty self-explanatory. Can everybody hear me okay?
Yes.
Okay, good.
Loud and clear.
Okay, good. So Pfizer is the largest research-based drug maker in the world. The company's diversified global healthcare portfolio includes human and animal biologic and small molecule medicines and vaccines, as well as nutritional products. Their products are marketed in more than 150 countries. Pfizer also collaborates with other biopharmaceutical companies, healthcare providers, governments, and local communities to support and expand access to reliable, affordable healthcare around the world. You go to the next slide, please. Some of their key historical dates. So in 1849, Charles Pfizer and Charles Earhart founded Charles Pfizer and Company in a red brick building in Brooklyn, New York, and I found a little picture of it there. They launched the first domestic production of tartaric acid and cream of tartar in 1862. These products are vital to the food and chemicals industry. Tartaric acid is used in baking powder. It's used for preserving foods and is very important in the carbonated beverages. In 1880, Pfizer begins manufacturing citric acid, and citric acid is used as a natural preservative. It's used in food for additives, and it's also a flavoring agent, and it's what makes sour candy sour. So if you like Sour Patch Kids, that's the sour part. Let's see, next slide, please. In 1891, the co-founder Charles Earhart dies and leaves a partnership worth $250,000 to his son William. 1899 marks the 50th anniversary of Pfizer. And then finally in 1900, they file their official articles of incorporation in the state of New Jersey. In 1906, Charles Pfizer passes away and his brother Charles steps in and succeeds him. And then in 1928, Alexander Fleming discovers the benefits of penicillin mold, and this changes the future, or assists in changing the future for Pfizer. At this point, in 1944, Pfizer becomes the world's largest producer of the miracle drug penicillin. In 1951, operations are established in Belgium, Brazil, Canada, Cuba, England, Mexico, Panama, and Puerto Rico. And then following that, the agricultural business division is established. Next slide. In 2000, Pfizer announced that it would buy the Warner Lambert Company for $90.27 in stock. This created the world's most valuable and fastest growing pharmaceutical company. In 2002, they merged with Pharmacia. I think I may have said that wrong. This merger gives them full rights to the product Celebrex. Let's see. I hate to read every single one of these, but let's keep going. In 2009, Pfizer agrees to buy Wyeth for $68 billion in cash, shares, and loans, and this positions Pfizer as the largest pharmaceutical company in the world. In 2015, Pfizer enters into a merger agreement and acquires Hospira. And in 2016, IBM and Pfizer work together to accelerate immuno-oncology research for drug discovery. Next slide. May 2019, a new $9.8 billion consumer health business was created by GlaxoSmithKline and Pfizer. This joint venture brings together the consumer health brands of Pfizer and GSK to make it a global leader in over-the-counter products. And in 2019, Pfizer acquired Array Biopharma for $10 billion and gives Pfizer access to Array's approved drugs for skin cancer and the targeted cancer medicines in its pipeline. The acquisition of Array Biopharma brings that portfolio that includes multiple approved uses for pharmaceuticals in the treatment of melanoma. Pfizer and Array plan to maintain the current Array operations in Massachusetts and North Carolina, as well as Colorado, becoming part of the Pfizer Oncology Research and Development Network. Okay, next slide, please.
All right.
Products and services. Sorry, go ahead.
This is Matt. These are my slides coming up here.
Oh, okay, go ahead.
You see on this slide, it says all total, Pfizer currently produces 198 different types of drugs. We have a diagram here on the right-hand side that shows their top 10 bestsellers for 2018. A lot of familiar names on there like Prevnar, Lyrica, Imbrin, Eliquis, Enbrel, Lipitor. And then we show on this other side here their top 5 all-time. Most of the same names there: Enbrel, Eliquis, Prevnar, Lyrica, and Lipitor. I actually kind of found it kind of surprising that Viagra was not on this list of all time. But if you could go to the next slide, we'll show the current. Currently, Pfizer has 101 different drugs in the different phases of manufacturing, from phase 1, which is the very early development, all the way through phase 3 and registration, where they're about to hit the market. These different areas that they try to manufacture drugs in are broken down into 6 therapeutic areas. They are hospital for anti-infectives, inflammation and immunology, internal medicine, oncology, rare diseases, and vaccines. And currently, some highlights for the ones that are currently in registration. There are 4 new drugs for helping treat with cancer, to include like lymphoma and leukemia, prostate cancer. There's 3 of them that fall into the inflammation and immunology category, which is 2 of them for rheumatoid arthritis and dermatitis, and 2 in the rare disease category. Next slide, please.
Okay, so Pfizer's vision is to change patients' health by innovation and breakthroughs. Their vision encompasses what their work is striving to do, and Pfizer works daily in order to create better outcomes for the patients in all stages. Next slide. The mission of Pfizer is to change patients' lives by funding programs that will advance medical care through innovative pharmaceuticals and providing those that are safe, effective, and affordable. Health for all is their core purpose and is what they strive for. Pfizer is constantly working to ensure people throughout the world have access to health care through the medicine and the vaccines that they produce. A major way that Pfizer carries out their mission is through the Pfizer Foundation. This foundation is a charitable organization, and it funds various programs that help underserved areas of the world by addressing the health needs and gives them access to quality health care. And to do this, Pfizer partners with various organizations in order to expand their access to medicines, and it wouldn't be able to do this without the partnerships. And next, we're going to use a Bell's model to analyze the mission in relation to the strategy of Pfizer. Who is being served? It's patients, healthcare providers, medical facilities, advocates, pharmaceutical companies. The unmet needs are internal medicine, inflammation and immunology, oncology, rare diseases, and anti-infectives. How will the needs be met? Through research and pipelines focused on metabolic diseases, cardiovascular risk, gene therapy, vaccinations, autoimmune diseases, and cancer. And like we said before, the mission is to change patients' lives by funding programs that will advance medical care through innovative pharmaceuticals and providing those that are safe, effective, and affordable. This asks us to look at who is being served, what needs are unmet, and how will the needs be met. First and foremost, the patients are being served. Like, that's the main priority of Pfizer, while all the others, like the healthcare providers, medical facilities, they're all avenues in which to get to patients. The unmet need is the medical care and certain aspects of care that are not as focused on. And Pfizer focuses on meeting these needs by, the research and development of specific to these areas in order to create the breakthrough medicine and treatments for the patients that are in need. Next slide.
So hi, this is Kim for the environmental assessment. Pfizer actually operates in both the consumer and the industrial sectors. Pfizer's consumer markets include over-the-counter medications like Advil and Centrum vitamins. They also offer popular prescription medications that we've already heard a number of them, but also including Celebrex and Lyrica. And Pfizer is also active in the industrial sector with their surgical products and their injectables. And the economic indicators that Pfizer uses to make their strategic decisions include GDPs in various countries. GDPs and populations are just two of the factors that Pfizer can use to analyze whether to enter a country to do business. The health and the age of populations are also critical factors that Pfizer can review in order to determine the type of products that a population may need currently or products that they may need in the future based on whether they have health care, their ability to purchase health care, or healthcare products in that particular country. The employment rates of countries are also important to determining whether customers have access to employer-based insurance or government-backed insurance. Another economic indicator that Pfizer must be keenly aware of when focusing on countries in which to do business is the government regulations that may or may not be present. Pfizer noted in their latest 10-K filing that government regulation is extremely important and is actually a major factor in their decision-making on pursuing business in certain countries. And finally, an important market force that Pfizer must strategically offset is the number of expiring patents that are held by the company. Competitors' ability to manufacture generics is a threat to Pfizer and its competitive advantage in sales of patent-protected medications. Next slide, please. This slide basically just shows Pfizer's revenues for a period of about 8 years in the global markets, with the U.S. leading every year. The majority of Pfizer's revenues come from their presence in the United States. If you add to that an aging population to the already high revenues, the United States is actually expected to continue to be the leader in revenues for Pfizer as it moves forward into the future. The next slide. This is just GDP comparisons. And as we've already noted, Pfizer actually operates in more than 100 countries. So just for sake of comparisons, I chose two of the major economies to compare and two emerging economies in terms of GDP. These are GDPs that Pfizer would actually use to analyze when determining either to enter a market or actually focus their research and development activities in those markets. So the first on the left side is comparing the United States and Japan as two of the major economies. The U.S., of course, clearly stronger than Japan for the period of 2010 and anticipated through 2023. And then on the right side, emerging economies, actually comparing China and India. And these are noted as emerging economies for Pfizer. China and India both rising, but still not as lucrative to Pfizer as the U.S. and Japan. Next slide. This is taking a look at population comparisons, also choosing the same two major economies and emerging economies. Population stats, of course, are important to Pfizer in determining strategy and their product offerings in certain countries. The same comparisons, again, are made in the GDP in terms of countries. Japan and the United States populations both remaining fairly steady during this period of time. While we look at the populations in the emerging markets, India, of course, showing a swift acceleration in their populations from about 2018 on into the future of 2023, surpassing China. This growth, of course, warrants a closer look for Pfizer in order to target their pharma in these particular emerging economies. The next slide. So here we looked at market forces and organizational structure. In 2018, Pfizer announced a change in their organizational structure. They split the company into 3 different divisions, each of them represented here. This allowed Pfizer the ability to focus on a specific area of business in the pharma industry. Those three divisions were innovative medicines, established medicines, and consumer health care. A little bit of information about each one. Innovative medicines was established to focus on biological sciences and new hospital medicines. This division is expected to produce the majority of Pfizer's overall revenues. This division will also focus on diverse patients in diverse markets. And then established medicines. This is a very important area for Pfizer. Again, as we've already noted, the lost patent protection of some of their more popular drugs. This area is looking to manufacture its own generics in order to compete with other generic makers. And then finally, consumer health care. This division focuses on over-the-counter medications, including consumer needs and industrial requirements, which are serving hospitals and other healthcare institutions. This division will seek to understand how shifts in consumer needs will require shifts in Pfizer's product offerings to remain competitive. And the next slide. An analysis of present conditions and trends. So pharma is highly regulated, which creates a high barrier for entry. Research for a single drug is extremely lengthy in terms of years, and it comes with a very high cost. After years of R&D efforts and, of course, millions of dollars, a long-awaited drug could fail to pass government regulations. This investment required just to study a drug and seek approval. That single activity deters competitors from entering the market because of its high cost and long term. Pfizer's economy of scale in terms of the number of countries with a market presence and the stable performance in those countries is actually a positive indicator for strong performance for Pfizer. Again, their expiring patent protections and threats of generic makers has pushed Pfizer to create its own generic products in order to continue to control its existing market share of certain medications. And then contingencies and alternate futures. These include competitors' entry or exit. Accessibility to raw materials is currently not a concern for Pfizer in manufacturing its pharma products. However, government regulations are a concern and has the potential to deter Pfizer from entering certain countries or expanding the operations they already have in those countries. And government unrest also is something that Pfizer is concerned about in some countries, and regulations vary and are constantly changing from country to country. Next slide. I think we're turning it back over to Sarah.
Okay, here we have the Porter's 5 forces. The threat of new entrants in the pharmaceutical industry is low. The cost of entry is high because of research and manufacturing. The time it takes to gain entry into this industry is high as well, since there is a need for new products constantly, and new companies don't have the resources or the budget to get these products out in a timely manner. The bargaining power of suppliers is low because there are limited supplies needed, since the products or the drugs are manufactured in-house. There are also various choices of suppliers on the already limited number of supplies that they need, so they have low bargaining power. The bargaining power of buyers is low. Buyers do not have much power because the price of these drugs are set whether by the company or by the government. Many of their drugs are available by prescription only as well, so that limits the power of the buyers. The threat of substitute products is moderate based on the fact that patents run out and other companies can make generic forms of a drug for cheaper. Drugs have to be modified to meet new standards and requirements, so they are also replaced with newer versions. The threat is low to the outside world, but within this industry itself, the threat is moderate to high. Competitive rivalry among existing firms is high, since there are no other substitutes for pharmaceuticals, and some of these are needed for survival. The rivalry is high because many of the pharmaceutical companies make similar drugs and are trying to get the buyers to decide that theirs is the best choice for them or for their patient. Next slide. The industry life cycle. Excuse me. The life cycle refers to 5 stages that an industry, business, or product is in. At any given time, they are in a stage, whether it's embryonic, growth, shakeout, mature, or decline. Pfizer was founded in 1849 by 2 cousins from Germany who set up shop in Brooklyn, which sent them into the embryonic stage. And throughout the rest of the 1800s, Pfizer was in the growth stage since they were finding out like who they were and they were expanding their business. The growth stage shifted to shakeout around the 1900 with the filing of the certificate of corporation, which is when their rivalry became the most intense. And in the 2000s, when they merged with a few other companies. Today, Pfizer is in the mature stage since they're maintaining their place in the pharmaceutical industry and are trying to maximize their profits and continue to merge with other companies, and more recently with Mylan, with all of the technology that continues to be invented and the research that is done on drugs. This industry isn't going to decline for a while because there's not a suitable replacement for the products or for what they do. Like it says, the industry easily blocks the new entrants because of the cost involved in entering, and profit maximization is crucial to the pharmaceutical team because of the research and development that's included in the nature of their products. Next slide. Here we have the BCG matrix, and this is used to describe where the products are positioned in a company. By knowing where the products fall in one of these 4 categories, this allows the company to determine the priority that needs to be associated with each product. Stars are high market growth rate, high relative market share. These cause leaders in the market to be reached and sustained. They require significant investments, but will be profitable since they are the leaders in the market. And for Pfizer, their stars include their work with oncology and cardiology. Cash cow is low market growth rate and high relative market share. Cash cows usually generate the highest revenues, and the investments that are needed are low. Cash cows have competitive advantage that allows them to remain profitable and in high demand since only Pfizer can make these products. Once the patent is expired, the entire market has access to creating alternatives to this name brand, which normally causes the cash cows to diminish to dogs. Currently, the cash cows for Pfizer are Lyrica and products in the Prevnar family. Question marks are high market growth rate and low relative market share. These products have high demand, but a lower market share. These require cash investments and no promise of a return, which is why most of their products begin as question marks. Eucrisa is an eczema ointment for children that's up to 2 years old, and it's showing positive results, and it just came out not too long ago. So this product has the potential to turn into a star. Dogs are low market growth rate and low relative market share. Dogs are the least profitable and require the least amount of investment. For Pfizer, their dogs are now Viagra, Lipitor, and Detrol. And these were once cash cows for Pfizer, but they can now be obtained cheaper through the generic brands. Next slide, please. Critical success factors are strategic focus, people, operations, marketing, and resources. For Pfizer, their strategic focus is research and development, clinical trials, product pipeline, their focus areas. For their people, it's scientists, executives, patients, and the buyers. Operations, they have responsibility, protection, health policies, transparency, and patient assistance. Marketing's advertising, relationships with healthcare providers, and their resources are financial, collaborators, products, and patents. Critical success factors are important for a company's success, so they have these to monitor to ensure that they're staying on top. These factors are specific to Pfizer, and it's what makes them successful. Next slide.
So capabilities analysis. We did a SWOT analysis and strengths, weaknesses, opportunities, and threats. So for Pfizer, their strengths were certainly research and development, with the largest of all research and development of its competitors. Pfizer also hires highly skilled workers and has shown clear pharma expertise when entering new markets. Their global presence is also a strength when it comes to exchange rates, because a decline in one country can be balanced by growth in another market. Pfizer also has a reliable distribution network, established customer relationships, and receives returns on its capital expenditures. As for weaknesses, Pfizer has had some failed drugs, which equal loss of investment dollars. Although they have a strength, as noted earlier, of skilled workers, finding skilled workers in certain emerging markets is actually difficult, and so it is a weakness. And another weakness that was noted as a strength is their spend in R&D. In comparison to other competitors, in terms of innovation, it's considered a weakness. And their acquisition integrations is also a weakness, with the complexities of integrating other pharma companies into the Pfizer organization. And then as far as opportunities for Pfizer, includes marketing new products to new customers, especially in emerging markets. Pfizer could benefit from using data analytics to develop needed products in emerging markets in order to capitalize on the needs in those markets that are unfulfilled by others. And finally, threats for Pfizer, again, includes their generic drugs, which are made by competitors, especially for the drugs that they have lost their patent protections. Government regulation is also a threat and is experienced in nearly all of the countries in which Pfizer does business. Another threat is liability claims and the likelihood of future liability claims. That's a serious threat to Pfizer, as is imitation and counterfeiting of drugs, especially in emerging markets. Next slide. I think it's Jeff now.
Okay, so when we're looking at the financial performance and the trends, I kind of wanted to bring out some graphs and to be able to show some of the increases and declines and kind of walk through those with you guys. So there was a dramatic increase from 2009 to 2010. Of course, this is due to the extra revenue from the products that they acquired from Wyeth when Pfizer took over the company. You kind of see a decline from 2010 to 2015. This is due primarily to the patent expirations, not the patient expirations, but the patent, and I'll fix that, on medications such as Lipitor, Plavix, Celebrex, and antidepressant Pristiq. Pfizer's revenues kind of increased in 2016 due to the addition of some new products and acquisitions from Amicor Pharmaceuticals and from Mediviation. And then 2018 revenues for Pfizer is due to the growth of 3 drugs. One is Elbrance, which is a breast cancer tablet. I'm not sure how I'm going to pronounce this, but Exlagenzel, which is a rheumatoid arthritis tablet, and Eliquis, which is a blood thinner tablet. And again, I apologize for murdering these names. Looking at the operating margin, you can kind of see there's some drastic increases and decreases in this as well over the from 2009 to 2018. To note, from 2010 to 2013, Pfizer's operating margin increased by 9%. Again, this goes back to the acquisition of Wyeth, and it produced a large increase in the volume of sales that they were able to put out. From 2013 through 2016, the operating margin decreased by almost 7%. Again, this goes back to the patents that were expiring. The expiring patents allowed for generic medications to hit the market. They became available from other suppliers and other companies, and it decreased the revenues coming in from Pfizer. And then the 3% increase from 2017 or in 2017 from 2016 is due again to those 3 drugs, the Elibrance, the Eliquis, and the one that's named X. And I apologize that I don't know how to pronounce that. Looking at return on investment, return on assets, you can see kind of it's following kind of the same trends. Kind of wanted to put them together. With both ROI and ROA, you can see a slight increase up to 2013. Again, it goes back to your acquisition The decline from 2013 to 2016, again, goes back to what we've just been talking about, to the patents, generic medication sales increasing, and so you really don't have a good return on your investment. And then the increase in 2017 was due to a large number of oncology products that got approved, that were in the pipeline, that the FDA approved it and it was ready to go out. I felt these were important as far as your long-term debt and capital, your debt equity ratio, your cash to debt, and your current ratio. For Pfizer, their long-term debt from 2017 to 2018 has been built up from $31 billion to $34 billion. This current cash and short-term investment, it levels during this time, and it is about $12 billion. Pfizer has also generated cash from operations of $16 billion over the same period of time. This means that Pfizer's 2018 level of operating cash is high enough to cover its debt. Pfizer's current ratio in 2018 was 1.57, which is good because it indicates that they have enough cash buffer without holding too much capital in low return investments. And then Pfizer's debt to equity ratio of 65% could be considered an above average leverage company. But this is not really unusual for companies with large market capitalization, since their debt tends to be less expensive than equity because their investment or interest payments are tax deductible.
This next slide is about the functional strengths and weaknesses of Pfizer. As previously stated, Pfizer is one of the largest drug manufacturers in the world and has a presence in over 150 countries worldwide. They're currently broken down as a functional structure into 3 sections, which is innovative medicines, established medicines, and consumer healthcare. This leads us to one of their strengths, is that their size gives them quite an economy of scale, that they're able to produce stuff that other smaller companies might not be able to at a lower rate. Another strength is that they have an entire section that's devoted nothing but research and development, as we see previously that they need to continually be coming up with new drugs, because as their patents fall off, their return on their investment keeps falling off. The ones that don't get approved ends up costing them extra money. So the continued R&D is vital to their company's growth and continued growth. They do have multiple patents, but a lot of them are expiring. And once again, it goes back to they need to keep producing more drugs to keep these cash cows from turning into dogs and eventually losing their market position. They do offer a wide range of medications, both prescription and over-the-counter. This diversification helps them to not only maintain their market share, but grow, and it actually helps them minimize their losses when one area starts to slip into the dog category versus another one. One of their functional weaknesses is that although one function may end up making money, they actually end up costing, that function ends up supporting another function that is not profitable. In this case, both the consumer medicine and established medicine functions the consumer medicine function only accounts for 10% of the company's profits, and the established medicine function relies on products whose patents are expiring. So it goes back to the first one as their innovative medicine to help cover the losses in those sections. Next slide, please. Pfizer's largest resource that can be used to secure the competitive advantage is their vast research and development function, innovative medicines. Pfizer's current focus is in the areas of oncology, cardiology, and genetics with the goal of clinical innovation. With this goal, they focus on 3 areas, which is patient engagement, making work easier at their sites, and leveraging real-world data. Their supply network is vast, as previously mentioned. It consists of 87 sites, 188 logistics centers, and 500 supply partners with over 30,000 employees worldwide. And for the strategic alliances, Pfizer has partnered with the Trans Celebrate Biopharma, which is a nonprofit that focuses on innovation and research and development that solving problems and improving safety. Next slide, please.
So goals, looking at the financial goals for Pfizer, what I did is I kind of took the trends and did a forecast, but also looking at current things that they have that are in their pipeline, also what they feel like is involved in some of their pro formas for 2020, and also their addition of the Milan and Upjohn that they are currently working on as well. So basically, with this, there's a summary slide that will be a couple slides from now, but just kind of want to walk through these so you can look at them. So basically for sales increased forecast by 11.5 million into 2025 with the way that Pfizer seems to be heading based on the research that I was looking at and their trends. With their operating margin, it looks to be increasing by about 2.5%. They're currently the industry leaders in sales and operating margin in their industry. And in 2025, if they hit their forecasted goal, they should be able to maintain being the leader of the industry. It's pretty strong. For their return on investment, you can see here that it will increase by almost 4.4% in 2025. And that means that, the investors will kind of get a better return in 2025 on their investment. For the return on assets, it should increase by about 2.3%. This should give us a good indication that Pfizer is utilizing their assets to generate more earnings. Looking at long-term debt and over capital, it should decrease by about 0.08 and should be at about 0.26. This shows that they have some good financial leverage. And they're going to be using their capital properly. With the debt to equity, it's reduced down by about 4.14. This indicates that it is reducing the amount of money it's financing with debt to grow the company. And with the cash to debt, we can see a 0.27 increase, which is an indication that they are going to be better able to pay back their any debt that they may have in the 2025. And also it will indicate that they're able to take on more debt if necessary, if they do need to acquire more companies or do more acquisitions. With the current ratio, it's also more favorable and shows that they can more easily make current debt payments as well. So the slide on the top left is basically a summary of those goals and those graphs that we just went over. It kind of gives you a breakdown of actual for 2018 and actual for 2019. And again, the goal for 2025 is really based off of forecast, looking at trends, looking at what their pro forma is, and looking at some of the ways that they believe that they will grow over the next few years. So you can see all those changes summarized there. Another one, a graph that I really wanted or felt was necessary, was the debt to EBITDA. And it's here. It shows your forecasted growth too into 2021. And I'll go over that as well. So basically, reading some of the first quarter 2019 revenues versus the first quarter of 2018 for Pfizer, in their first quarter of 2019, their revenues totaled about 13.1 billion. It was an increase of about 211 million or 2%. And that, like I said, is compared to the prior year quarter. And it reflects an operational growth of about $664 million. First quarter of 2019, the biopharma revenues totaled $9.2 billion. It was up 7% operationally, and this was primarily driven by a few things. One was Eliquis globally was up 36% operationally, and this was primarily driven by continued increased adoption in non-valvular atrial or AFib. Let's just say AFib. As well as oral anticoagulant market share gains. Ibrance globally was up 25% operationally. This was primarily driven by 107% operational growth in international markets. This was reflecting continued strong uptake following launches in developed Europe, Japan, and certain emerging markets. Also, Ibrance was a 2% growth in the U.S., reflecting continued moderated volumes and approved metastatic breast cancer indications. Another reason that they were up 7% operationally was because of Prevnar. It was up 10% operationally. This was driven by like a 31% operational growth in emerging markets. It was reflecting the favorable overall impact of timing, increased volume associated with government purchases for the pediatric indication, and increased shipments associated with GAVA, which is the Vaccine Alliance. And also, with Prevnar, there was a 6% growth in the U.S., and this reflected increased government purchases in the first quarter of 2019 for the pediatric indication. The Exeljanz globally contributed again to that 7% operationally because it was up 34% operationally. This was driven by 89% operational growth in international markets. And this was primarily reflected continued uptake in the rheumatoid arthritis indication as well from the recent launch of the ulcerative colitis indication in certain developed markets. And there was 18% growth in the U.S., and this reflected strong volume growth in the rheumatoid arthritis as well, and also from the launch of some psoriatic arthritis and ulcerative colitis indications. Also, adding to these revenues was the first quarter for 2019 for Upjohn and the Upjohn Mylan joint merger, and basically the revenues totaled $3.1 billion, and it was up 1% operationally. This indication was because of the 25% operational growth in emerging markets, driven by strong volume-driven operational growth in China, primarily from the drugs Lipitor, Novartis, and Celebrex. There was a 10% operational growth in Japan, and this was primarily driven by volume, very strong volume growth from Lyrica and Celebrex. The revenues again totaled because of a 13%, they declined by the 13% operational decline in developed markets. And these excluded Japan. It was primarily driven by lower revenues for Viagra. And this, basically the authorized generic, or Upjohn's authorized generic for Viagra in the U.S., it was resulting from increased generic competition following Viagra's December 27 patent expirations. Also, the 13% operational decline was because of Lyrica, primarily due to the lower volumes in the U.S. And basically, it was reflecting wholesaler destock in advance of anticipated generic competition that began on June 30th, 2019, and in developed Europe. with that being said, looking at Pfizer and looking at their pro forma and what they have for 2020, Mylan and Upjohn is expected to have revenues of 19 to 20 billion. The pro forma for 2020 adjusted EBITDA is anticipated to be in the range of 7.5 to 8 billion. It's going to include phase synergies of approximately about 1 billion annually. And this is to be realized by 2023. So the pro forma free cash flow for 2020 is expected to really be more than 4 billion. The new company, Mylan and Upjohn, will be focusing on returning capital to shareholders while maintaining a solid investment grade credit rating. It expects to achieve a ratio of debt to adjusted EBITDA of 2.5 times what it is by the end of 2021. The new company also intends to initiate a dividend of approximately 25% of free cash flow beginning the first full quarter after close, and the potential for share repurchases once the debt to adjusted EBITDA targeted is sustained. Competitive goals. So looking at the financial goals, we went through those. When we go to the competitive goals, we want to continue to be the leader in sales in the industry. Continue solid growth of their top products, such as Eliquis, Prevnar 13, and Eliprevent. Continue to grow globally and in emerging markets. I think one of the ways that they do that is with Mylan and Upjohn. We talked about it a little bit, but it's going to transform and accelerate each business's ability to serve patients, their needs, and expand their capabilities across more than 165 markets. And it's basically by bringing together the two highly complementary businesses. Mylan brings a diverse portfolio across many geographies and key therapeutic areas such as central nervous system, anesthesia, infectious disease, and cardiovascular. And it also has a very robust pipeline, high quality manufacturing, and supply chain excellence is what it's known for. Upjohn is going to bring trusted iconic brands such as Lipitor, Celebrex, Viagra, and proven commercialization capabilities. And it's also going to include leadership positions in China and some other emerging markets. The transaction will allow the new company to meaningfully expand the geographic reach of Mylan's existing broad product portfolio and future pipeline. It should include some significant investments that have been made across complex generics and biosimilars into new growth markets where Upjohn has existing sales infrastructures and local market expertise. The combination will drive a sustainable, diverse, and differentiated portfolio of prescribed medicines, complex generics, over-the-counter products, and biosimilars supported by commercial and regulatory expertise, established infrastructure, best-in-class R&D capabilities, and high-quality manufacturing and supply excellence. We need to continue to acquire some other small, low-risk companies. Pfizer has a lot of cash flow and a strong balance sheet that would enable it to make acquisitions. In May, the company announced it's buying privately held biotech Therachon Holding AG for $810 million. Therachon has completed a phase 1 study of a drug treatment for, I don't want to butcher this too much, but achondrodysplasia, which is a genetic disease that is most common form of short-limb dwarfism. This purchase adds to Pfizer's rare disease portfolio and research programs for pediatric growth disorders. I think they need to continue to be the technology leader in the industry by having a flowing pipeline of advanced treatment possibilities. Both Merck and Pfizer are developing successors to Prevnar, but Prevnar's patent for Prevnar would not expire until 2026. this allows them to fend off Merrick until then and gives them time to launch new drugs that they have in research and development. An example of this would be the 20-valent pneumococcal conjugate vaccines that they currently have in phase 3 for adults. And if this becomes approved, the vaccine could produce about $6 billion for Pfizer into 2020. Pfizer has delivered also, 5 regulatory approvals in the first 4 months of 2019. One of these was, of course, Elibrance, and Pfizer also got FDA approval for the thicillin amyloid cardiomyopathy in July. And overall, Pfizer has up to 15 programs with assumed blockbuster potential that could be approved by 2022. I think another competitive goal is to continue to pursue oncology drug market and gain market share. The cancer drug market is expected to accelerate to over $110 billion by 2020. The growth in the oncology drug market is coupled with high regulatory and research cost barriers associated with cancer drug manufacturing. Set up a large market that only companies like Pfizer and GlaxoSmithKline can attack effectively. There are further opportunities for Pfizer to move in on these emerging markets as they offer low regulatory barriers. I think also, continuing to build biosimilars platform. Pfizer is building a portfolio of biosimilars and expected up to 4 approvals this year alone. And that together could eventually add up to over $1 billion in annual sales. And then lastly, the company is also working on developing a gene therapy business through partnerships with companies such as Sangamo Therapeutics. And Pfizer is a strong partner for small biotechs in this area due to a significant manufacturing capability and an extensive sales force. I will turn that over to the next person.
I believe that's me. So strategic approach. Pfizer's strategic approach has largely been mergers and acquisitions, as you've heard throughout the presentation. Acquisitions allow Pfizer to offset expenses in certain markets and or countries. Mergers have largely benefited Pfizer, with a pending merger with Milan expected to benefit the company dramatically by expanding their generic drug business and their ability to compete with other generic drug makers that are already in the market. Jeff talked about that a lot. Pfizer has also benefited from alliances and joint ventures, which has allowed the company to expand their product offerings to consumers and expand their global presence. Next slide. Some of their strategic objectives for Pfizer include continuing their strong focus on research and development and staying up to date and competitive. Innovation, also an area that Pfizer could improve upon. A big acquisition could help Pfizer maintain its market share. A big acquisition will bring cost savings by streamlining operations and removing redundant processes. This will also create synergies to remain competitive. Financial experts speculated in 2014 that Pfizer was searching for an acquisition and that an acquisition was critical to their growth and potential profitability. The newly introduced competition with generics required Pfizer to swiftly make a move. Declining sales and loss of patent exclusivity, revenue was taking a hit. Research drug launches by Pfizer were loosely adopted by the markets and were impacting Pfizer's revenue growth. Pfizer set its sight on AstraZeneca. The intent of the acquisition was to revive growth and reduce cost. AstraZeneca had an established pipeline of drugs that would have been positive for Pfizer, but the acquisition did not occur. However, Pfizer had many other successful mergers and acquisitions that Jeff certainly talked about with Upjohn and Milan. And Brandy now will talk to us about some of the other mergers and acquisitions that were beneficial to Pfizer.
Thank you. So Pfizer has recorded 31 acquisitions that range from small pharma companies to large, well-known competitors. One notable acquisition in 2015 was Hospira that was worth $17 billion. The Hospira acquisition allowed Pfizer an opportunity to expand its global presence. Pfizer was able to grow Hospira's products into Pfizer's strong established global markets and expected to generate savings of $800 million in the 3 to 5 years following that acquisition. The merger with GSK, or GlaxoSmithKline, in 2018 was another notable transaction for Pfizer, with the two companies creating a powerhouse company that could dominate the consumer healthcare market. The latest acquisition by Pfizer to acquire Mylan will further Pfizer's strategy to enter the generic drug market. Several failed acquisitions are in Pfizer's history as well. One such failure in 2015 when Pfizer attempted to acquire Allergen when the U.S. Treasury Department blocked the acquisition, citing Pfizer's attempt to avoid U.S. taxes by merging with foreign companies. Next slide, please. And this is Ansop's matrix. It suggests that a business's attempt to grow depends on whether or not it markets new or existing products or new or existing markets. Pfizer works to increase sales of established products in existing markets while continuing to sell existing products in emerging markets. Their intention is to enter the generic market in order to stay competitive in the existing markets. Pfizer is working to create new products to distribute to new markets, which can be costly. This diversification of Pfizer is a risky strategy. However, successful can prove beneficial to the organization. Next slide.
That's me again here. What are the most important projects or programs that have been or will be or should be conducted in this company's strategies? The first one is the merging with Mylan in order to provide better health medicine worldwide. The FDA approval of their oncology and autoimmune drugs that are in that final stage of the pipeline. Opening of the biologics clinical manufacturing facility that's in Massachusetts. The new products that they currently have in the pipeline and participation in advanced market commitment with Gavi. The merger with Mylan is set to be completed in the middle of 2020 and will help fulfill Pfizer's strategy of making a large acquisition. This merger will combine Mylan, that's valued at roughly $10 billion, and Pfizer, that's valued around $240 billion. Pfizer investors will end up controlling around 60% of the new business, and Mylan investors will have the other 40%. The new entity will combine the off-patent drug business of Pfizer with Mylan's drugs that include Lipitor, Viagra, and the EpiPen. The combination of these two companies will make Pfizer the largest off-patent and generic drug manufacturers and help to continue to increase their economies of scale. To meet the strategy of the continued research and development and innovation, Pfizer currently has 101 drug projects in the development pipeline, with 9 of them in the final stage FDA approval. 4 of these drugs in oncology therapeutic area and cover diseases such as lymphoma, renal cell carcinoma, leukemia, and prostate cancer. Additionally, they have 3 new autoimmune drugs to help with the treating of RA and atopic dermatitis. Even further, implement their goal for continued innovation. Pfizer is open to state-of-the-art biologics, clinical manufacturing facility in Andover, Massachusetts. The new facility will include 5 independent suites for manufacturing and combine the R&D function with the manufacturing and other support activities all in one location. In an effort to expand into the third world nations, Pfizer has agreed to donate the vaccines to the Advanced Market Commitment Initiative that's run by Gavi. It's a vaccine alliance. The major requirements had to be met or will be met in order to complete these projects or programs successfully. Their R&D and manufacturing must work closely together in their new manufacturing facility. Having the right team in the right place, which is in each division, and their mergers and acquisitions. Which conditions in the external environment and or internal capabilities have facilitated or impeded the implementation of the firm's strategy or likely to do so in the future. The increased competition in the off-patent drug market and the structure of Pfizer has aided in a large acquisition strategy for Pfizer's innovative medicines division. Sorry, that was coming up. Next slide, please. On balance, how successful has this company been at implementing its strategy until the present? Given Pfizer's standing as the largest drug developer and manufacturer in the world, it's fairly safe to say that they've been highly successful at this point. As shown on the other slide, while not every venture that they've have tried has been successful, they've been successful enough to continue to grow. What recommendations would you offer to implement this company's strategy successfully in the future? Continue with their focus on research and development and product innovation, and keep looking for acquisitions that will further the market share. The merger, and the combination of the current competition in the off-patent generic drug market, Pfizer's corporate structure lended itself well to the strategy of large acquisition. The merger with Mylan was aided by the necessity and the ease at which Pfizer will be able to spin off one segment of its company and create a new one. The goals of continued research and development along with innovation have been aided by the corporate structure and the creation of the Innovation Medicine Division. That's it. Next slide, please. Yeah, looks like the end there.
And so that's kind of the conclusion. And if there's before I take questions, I'd just like to say that thank you to my team. Thank you, Professor Caddy, for the opportunity to go through this and do this. I think we work well as a team together. And I feel we know a lot more about the strategic process, but also a lot more about Pfizer as well, if we could just somehow figure out how to pronounce some of these names. But now I kind of turn it over to Professor Caddy if you've got any questions or anything.
No, that was very good. Clearly, you and your team put in quite a bit of effort in this in the presentation. So it's well done. I mean, my one question, I mean, it's clear this business is driven by pricing power. We can call product differentiation, patents, because when you can see the change in margins when a number of products go off patent. So the question really is, where's this? This only works if they have pricing power. And yeah, your strategy is to continue to develop innovative products, patented products, where I worked in a pharmaceutical industry, there is no relationship between what they charge and what it costs to manufacture the product. None. And you may know that when Part D Medicare went through, one of the deals that was made with the pharmaceutical companies was that the government, Medicare, is not going to bargain for pricing on patented products. So, I mean, what's going to happen in the future? Now we have people up on the stage saying Medicare for all. I mean, are the taxpayers going to want to continue to make sure that, because in the rest of the world, these prices are negotiated. It's only here they're not.
Right.
So what would be really interesting for me in a graph would be profitability by country. You showed clearly that the revenue in the U.S. was way above all the other, and we have 300 million people. That's not a lot, by the way. I mean, there are 9 billion people on the planet right now, and so the Europeans have as many as we do in the Eurozone, and the Chinese have 3 times what we have, and India has 5 times what we have. So, I mean, what is this going to be a viable strategy? Or maybe the reason they're getting it farther into the generic drug business is that they're going to go into more of a cost leadership, go toward controlling costs. I don't even know if that works.
Right.
The question is, where is this business going to go if we get this negotiation over price for drugs? If I worked for Pfizer, I'd be worried.
No, I agree with you, to your points, I do agree with you because they are dependent on their costs, and it looks like for me that what I can tell, or the best I can tell, is they're trying to take an approach of, like you said, with this Upjohn and Milan, is trying to hit these other markets with all these generic drugs to try to reach those people from a cost perspective, and trying to hit those people that have a very high population to hopefully hit those markets. Because you're right, with even in healthcare in general, it's interesting to see what's happening with everything healthcare wise in the United States. You talk about the Medicare Part D, but you start talking about the competitive bid and bidding with DME products, and also how reimbursement rates in insurances are, how they're decreasing. So I think strategically, and if you're dealing with healthcare, you have to figure out how are you going to survive all of these cuts and these cost cuts, or these reimbursement cuts, and how are you going to cut your costs to still remain profitable?
Yeah, that's the gorilla in the room. How are you going to do that? I don't think anybody has answered that. And at the center of this is this pharmaceutical, and there's so many things going on. I mean, it's like generics. I never realized that a lot of the generics are made in China until one of my medications had a recall because it had too much nitrosamine in it. And then you could still buy the same, it was a generic medication in the U.S., but I was getting this stuff from China, so that was recalled. It's the biggest cost in manufacturing most of these things is quality control. So, how's I never thought about it, but how's China going to interact in this whole business going forward, especially with generics? I don't know.
Right.
That it's going to be a challenge, and I travel around the world. I can tell you in the hospital, in the medical business, in the rest of the world, surgeons don't make $300,000-$400,000 a year. Doctors don't make, a GP doesn't make $100+ a year. Just somebody, the dollars have to come from somewhere, and it seems they haven't talked much about. If they reimbursed all these hospitals at the Medicare rate, they'd all be out of business.
Agreed.
And so it seems they've targeted the pharmaceutical business right now. So it's going to be interesting to watch. It's your presentation is correct, right on. They maintain pricing power. I mean, it's like which one is it? They have one now that's a blood thinner. In the old days, you used to take warfarin and have to go in and be titrated all the time. Now, I think it's Embryo or something like that. Is that what it's called?
Elis, the ELIUIS. Sorry, I can't pronounce it correctly, but that's their blood thinner, one of their top 5. That was one of the top 5 all time.
It's interesting with Viagra. The reason it doesn't make really high volume is because most companies, because this stuff, again, it's not paid for by the consumer. It's paid for by either your insurance company or the government. And Viagra was never in most of the formularies, because if you work for a company, the drugs that your company's insurance carrier covers is in what's called a formulary, and Viagra is not covered by 90% of the formularies, and Pfizer took the approach that they weren't going to drop the price to sell it, because it was coming out of pocket for somebody. So had they dropped the price to something out of pocket that somebody's willing to pay, they would have sold a lot more. But they never did that. They said, we're going to maintain this crazy price that we have, which is a crazy price. It was like $60 a pill. And we'll just take the lower volume, but we're going to maintain our margins. Anyway, it's an interesting business, and you guys did a good job. Thanks.
Thank you. I appreciate it. Thanks, everybody.
Thank you.
Thank you, guys. Gals.
See you around, guys.
See ya.
Bye.
Bye.